Hi everyone, my name is Neko Bidima, and this video presentation is going to be about innovation of the EKG app. In the next slide, we're talking about outlines. This outlines that all the topics I'm going to discuss in the slides. The first one will be the problem the innovation will solve, background of problems, innovation collaborations, utilization of appropriate technology, innovation solution, conclusion, and of course reference page. The next slide, we're going to talk about problem the innovation will solve. So we cannot be talking about the EKG app without mentioning hypertension, because we know that hypertension is one of the leading cause of cardiovascular issues in the United States. So we're going to start by defining what hypertension is. Hypertension is a condition that forces the blood against the artery wall when the levels are too high. In 2019, it has been noted that at least more than 500,000 deaths in the United States had hypertension as a leading factor and cause of death. About half of adults, 45%, with uncontrolled hypertension have a blood pressure reading of 140/90 or even higher. This includes 37 million US adults, according to CDC. What are the solutions we can do to avoid the high mortality rate of uncontrolled hypertension? There are a series of interventions we can do. So we can seek help timely, because if something is diagnosed early, then we can treat it and then the prognosis can be better. So seeking help in timely manner can help to decrease mortality rate. The next thing we're going to talk about is atrial fibrillation, because we cannot talk about an EKG app without talking about atrial fibrillation, because we're able to know a patient is AFib through the readings we get on our EKG or cardiac monitorings. So first of all, start by defining what atrial fibrillation is. It's a disorganized, rapid, and irregular arterial activation with the loss of arterial contraction and with an irregular ventricular rate that is determined by AV nodal conduction. In the United States, it is shown that approximately 2.7 to 6.1 million people are estimated to have AFib. And we want to ask ourselves, who are the population that are common with AFib? And according to research, it's been noted that it's mostly common in elderly, because the elderly population are the ones we see that have all these comorbidities like hypertension, heart disease, coronary artery syndrome, coronary artery disease. So those are the main reason why it's very, very prominent in this population. So solutions, like what can we do to be able to solve this problem? So what we can do is if we are able to identify AFib early, we can help decrease, let's say like DVT, blood clots, thrombolytic episodes. Because when we dictate these patients are on AFib, then we are able to put them on anticoagulants, which will help prevent the clots. And when we do that, we can also, when we put them on these medications and treatments, we're also avoiding abnormalities in cardiac function, which can cause all the different heart issues. And also we're giving the patient more quality of life. So the next slide, we're going to talk about background of problems. So we know that a lot of articles and textbook has defined hypertension as a silent killer, and is actually one of the leading causes of cardiovascular disease in the United States. And we also noted that most patients with hypertension go years without the illness being diagnosed. So these patients have hypertension, but they don't even know they have hypertension, because some people are not in the habits of going to see their primary care. So if you don't see your primary care physicians for your yearly workup, you tend to just go along and don't know you have hypertension going on. So, undiagnosed hypertension can lead to a series of problems such as stroke. We're talking about chest pain. We're talking about heart failure. We're talking about heart attack. These are the kind of problems you can have when you have undiagnosed and uncontrolled hypertension. So, between 1999 and 2006, a total 1.7 million deaths were assigned to an underlying cause of hypertension. And this death increased further in 2016 with a percentage of 92.5%. So that's actually a big increase. So that means it's becoming a norm that a lot of people are going about undiagnosed and thereby causing a lot of health issues which lead to death. So hypertension is a key factor when we're talking about coronary artery disease and any cardiovascular disease. Is actually the main driver, and it remains widely undetected, untreated, and poorly controlled, especially in underdeveloped area. Because another thing we have to consider is social economics works is actually a big factor in people seeking help. Because when people don't have enough money to eat, the least of their problems is to go waste that money to get treatment because they want to feed themselves first before they treat themselves. Okay, so that's where we see this hypertension undiagnosed and untreated and poorly controlled because these people are not buoyant enough to actually call it in need to go take care of themselves. So the government experts and programs and healthcare providers are trying to introduce, like a proper way to manage hypertension and to also dictate it early, because they noticed that the last study they did, because of the early detection and management, there was a lot of improvement. And the patients reduced hospitalization, stroke was reduced by 17%, cardiovascular issues were decreased by 35%. So it's something that we encourage because we always tell our patients if we can catch it early, then we can give you a better prognosis. Catch it early, start treatment immediately, and we hope for the better. So the next slide we're going to talk about is we're still on background of problems. Now here we're focusing on AFib, and when I say AFib, I mean atrial fibrillation, and is known to be the most common reason why people have cardiac dysrhythmias, right? And it affects 1.2% of general population. And I was actually reading a research, and it was more of European descendants, but it still affects everybody. Over 6 million people suffer from this atrial fibrillation, and it's expected to increase in number in the next 50 years if we don't detect it right and early and commence treatment. So it's also estimated that 12.1 million people in the United States will have AFib in 2030. In 2019, AFib was mentioned on a lot of death certificates. The numbers are on the slide. And the underlying cause of these deaths were AFib. So it plays a major part in our cardiovascular issues. Also, we had a research that recorded for 4,554 hospitalization with AFib as a primary diagnosis happen each year in the United States. The condition contributes to almost about a lot of deaths each year. The death rate from AFib as primary or contributing cause of death has been rising for more than 2 decades, according to CDC. So pretty much it's just the numbers are telling us that it's increasing. A lot of people having this AFib is increasing because we are not dictating it, we're not treating it, we're not finding solutions for it. So it's causing death, and it's going to keep rising if we don't take it seriously. So according to recent research, introduction of anticoagulants help with the reduction of AFib. So any patient that has any any atom of AFib. Because what is AFib? Like the blood is pooling, so there's room for clot. So if we can identify this early, we can put this patient on aspirin or even Lovenox or what's the other one they call it? They call it Eliquis, and we can be able to avoid all this DVT, thrombosis, and the rest of them. So the next slide, we're going to talk about innovation collaboration. So this is talking about the people that helped me with this innovation, and these are the people I interviewed. So my first interviewer is a 55-year-old female who is a cleaner from Nigeria. She suffered from cardiac arrhythmia secondary to hypertension since the age of 32. The second interviewer is a 43-old Hispanic female who is a lab technician who was born with a heart defect. And the third interviewer is a 40-year-old African American female who is a receptionist and was born with irregular heartbeats. So these three interviewees was chosen because they all had a cardiovascular disease and had a difficult time managing their illness. So that was what made me use them for this research. And also, these three individuals were culturally diverse and they all used the EKG app. So they were able to give me a very correct feedback and accurate feedback about the mobile EKG machine. So the next slide, we're going to be talking about utilization of appropriate technology. Now, this whole presentation is about the EKG app. So whenever you hear a patient say, oh, I have to go to the doctor's office to go do my EKG app, now we have smartphones, we have Apple Watches that have this technology in it. So we don't have to take a trip to the doctor's office to get that done. And also, this is free, it's easily accessible app that can be found on any smartwatch phone beginning from Apple Series 4 and new versions of iOS applications. The app is used to monitor low and high heart rates, measurement of atrial fibrillation, and arrhythmias. It helps with quick home and medical intervention, decrease frequent visit to the ER, save EKG interpretation that can be easily accessible by your PCP. So what I'm trying to say is this app is very convenient. One is cost efficient. Two, it's something you can use at home. If you feel a type of way, you press your watch and you're like, okay, am I having AFib? What is going on with my heart? It gives you a snapshot of what is going on in your heart. And if you're still worried, you can send the snapshot to your doctors, your PCP, and then they can give you instruction, oh, you need to come to the ER right now, or it's okay, it's nothing to worry about. At least it gives you that confidence that you can properly manage your health. So the next we're going to talk about the innovation solution. So what does this app do for us? And why is it a good app? Or why is it a good technology? So we're talking about it's cost efficient, it's portable, something you just wear on your finger and just on your wrist and even forget you're wearing it. It can store your EKG readings that you can always take to your doctor's office when you go there. It saves you limited trips to the ER because not before when we didn't have this, if you feel any type of chest pain, you're running and scampering to the ER. Oh my God, I'm having a heart attack. But right now you can actually have an EKG done with your watch and then send to your doctor. I'm like, oh, what do you think? Do I need to come in or not? So it actually does save you a lot of trips to the ER. And then it gives you your heart rate and, it gives you better management of any cardiovascular issue, and it's very reliable, and it's also FDA approved. So the next slide is going to be conclusion. So innovation and technology are very important in the healthcare system. The use of the recent mobile EKG app has helped a lot of patients and families to monitor their heart conditions, decreasing mortality rate, saves visit to the ER, and ensuring patients to seek help in a timely manner because like we said, if you can seek help in a timely manner, then your prognosis can be good. This technology and innovation is time and cost effective, thereby assisting users into limiting financial burden on individuals and healthcare system. And it's a very important part I like to emphasize on, because most of the time people that don't have insurance always find it very difficult to go to the ER because they're afraid of the bills that come with it. But if you have this smartwatch, it costs a couple of $100. You can get your readings from there, and then instead of going to get an EKG read, you can always go to your PCP and tell them, oh, this is what is reading, and from there they can properly manage you. And this is my reference page, and I hope you enjoyed my presentation. If you have any questions, feel free to reach out to me, and I'll be so glad to respond to you. Thank you.